We're going over hormones now?
We're going over hormones now.
We're going over hormones now.
If you were tuning out, waiting for the hormones.
There'll be 2 videos. But
Wake up! We're doing hormones now! Yay!
Okay, so I'm going to just reiterate what I'm currently taking.
Okay.
Building into this blood draw.
Yep.
So I was taking 200 milligrams, as you guys have heard me say, twice a week. Every 3.5 days, I was taking 100 milligrams of testosterone cypionate. No HCG, no E2 blockers like Arimidex or something like that. Just testosterone cypionate injectable in my ass. That's it. That's what I was taking, and that's what I was taking building into this blood draw. The only thing worth knowing is that I got this done on day 4. So I'd gotten 100 milligrams, and this is day 4. This is our first blood draw since switching to twice-a-week shots. Previous blood draws in general have all been on day 8 after doing once a week 200 milligrams. So, with the foundation laid, let's dig into it.
Okay. So the fact, you brought up a really interesting point there, that we did this blood draw on what's called a trough day, meaning from your shot to your next shot, that lowest point where your dose is, where your hormone level is going to be.
Right.
And it was still really high.
I know.
Yeah.
I know.
So your total testosterone is 914.4.
Whoop whoop!
So anything over 836.0 is abnormal. Yeah. So this is not, we can't let you hang out
No,
here
it's not
for
where we
too
want to live.
much
So
longer.
my total T again, 914. Everyone who's been speculating, yes, it's in my face. It's too high.
Yep.
It's too high.
Yep. And then we look at your free testosterone, which is that more
bioavailable.
Yeah,
And
the
it's-
more active form, and that's high,
And
too.
that's real high.
You want to read that number?
249.7, range being 50 to 210, is that picograms per milliliter? Picograms per milliliter?
I think so.
Sweet.
I should know that.
No worries. So it's much too high as well. So again, these numbers are on my lowest day. I will clarify that, and I will link old blood work videos. They've never been this high, and I've never cheated on my dose. I don't know. I've been wondering when I saw that, like, what attributed to? Is it that we split the dosage into every 3.5 days? Is it my diet? Is it my body responding naturally better? Like, why is it so much higher?
It's so much higher
Than it ever has been before. Because the highest I think it's ever kicked back before was like in the mid 400s on day 8. Granted, it's a lot more time, but I also was taking double the dose and then waiting.
Right.
So I was a little surprised. I don't care if some of you weren't. You see how I'm getting self-conscious and defensive?
It's okay, Noah. It's okay. We all love and accept you.
Thank you.
And your testosterone, wherever it is.
Yes.
Except as your doctor. Actually, we do need to talk about this.
Of course. Let's get through the rest of the values.
Okay.
Let's talk about what we're going to do about it.
Sure. Progesterone's fine.
What's progesterone? Sorry, real quick.
For you, probably mostly made in the adrenals. Can have a calming effect.
Okay.
Yep. What I'm more concerned about with you, though, is your estradiol.
Estradiol.
Which is estrogen.
Right.
Which is high.
Which is high.
Well, it's high normal.
Someone brought up that ideally a guy on TRT should be shooting for 20s. Shooting for middle of the road at best. That high estrogen can manifest itself in terms of how it affects you in some unpleasant ways, depending on the person. And I was really happy. Last time my estrogen came back gorgeous on day 8.
Right.
But this obviously means that, by and large, I'm always too high. Actually, not by and large. I'm always too high.
Yeah.
If on the trough day it's 42.2 out of a range of 7.6 to 42.6, so that means I'm living
probably
in the,
higher
50s,
than that
60s for a couple
most
days.
Of the other days.
Yeah.
Yeah. So what your body?
Is that why I've been so emotional? Do I look fat?
No. Do you have man boobs? Gynecomastia? Okay, I don't think so.
No.
So your body aromatizes the testosterone to estrogen.
Right.
And we don't have you on an aromatase inhibitor because in the past that hasn't been an issue.
Right.
Now, at this point, I don't think the issue is so much that we need an aromatase inhibitor as it is that we just got to lower your dose.
Right.
Reassess. If it's still high, then we can talk about doing Arimidex.
Depending on how.
Or herbs or however you want to go that route.
Okay. Let's keep moving.
Sex hormone binding globulin, as the name implies, it binds to your sex hormones. So the lower that is, the more your free testosterone is floating
going
around
crazy.
bioavailable, going crazy because mom and dad are on vacation and the babysitter isn't here. A little bit is what's going on.
That's really funny.
So that's low, not unsurprisingly.
Of course. DHEA.
DHEAS is made it tells me a little bit about your adrenal function.
And that looks to be doing okay?
Mm-hmm. And it's actually a precursor that your body uses to make your sex hormones. So it's a good sign that that's normal.
Good.
It tells me that whatever adrenal support we've been doing is good, working well, and your body's adapting to it well.
Holy Testicle Tuesday.
Yeah. So FSH and LH are really suppressed.
Real quick.
Yes.
For anyone that doesn't know, what is FSH and LH?
Follicle stimulating hormone and luteinizing hormone.
And what is their function?
So these are signals from your brain to your gonads to say, hey guys, do your work.
Hey, yo, Mikey and Tony.
Yeah.
Pump out some good stuff for me, huh? And then the gonads are like, F you, Frankie. I'm not working for you no more for 10%. Something like that.
Ish.
Yeah.
Sort of. Your version's way more interesting. To make testosterone, to make sperm.
Right.
And there is a feedback mechanism to the brain. So what's happening now is because of your level of testosterone, your brain's getting the signal of like, whoa, I have way too much testosterone. I'm going to slow down this signal.
Right.
So now we're at a point where your level is high enough that you are getting suppression of your own body's natural pathway.
Which is probably pretty normal for a guy on TRT.
Can be normal.
Yeah.
I personally like to not suppress natural processes if we can.
Right.
Although looking back through your charts, this has, you have had that suppression for a while. And some docs even say that's how you know you're at the right dose, is you get that suppression.
Sure.
So there's conflicting opinions out there on that.
That was a nice little caveat.
Thank you.
If you will.
I will. I did. Actually.
Yes. Okay.
All right, and then your thyroid. Your thyroid is not happy. Although your free T3 and your free T4 are in the normal range, they're kind of at the lower end of the normal range, and those are the hormones that your thyroid actually produces.
Okay, I want to stop you real quick.
Yeah.
While we go over this, I just want to make sure that we're helping anyone that doesn't happen to know what the thyroid does or is.
Sure.
And I don't want you to give a long explanation by any means, but to the same effect that you explain the FSH, when you say my thyroid is not happy, where's the thyroid, and very briefly, what does it do?
Sure.
Please.
Yeah, so the thyroid gland actually sits...
Right now.
I'm going to do it if you stop yelling at me. The thyroid gland sits in the front of the neck.
Okay.
It puts out a lot of something called T4, a little bit of T3, and that is your thyroid hormone that it's putting out.
And what does it function? What is the function of T4 and T3?
So T3 is the main player. It's the active form. So your body turns the T4 to T3 as it needs it. And T3 is like stepping on the gas pedal for the metabolic process in your body. So it's stepping on the gas pedal, burn up energy. It's burn it up, make energy. So it makes your heart rate go up or your heartbeat at a normal rate, keeps your bowels moving, it gives you energy.
It feeds energy to the cells of the body in general?
It makes energy.
Makes energy.
So when people are hypothyroid, they tend to be overweight or have dry skin or constipated or actually depression.
And that means your thyroid is not functioning properly in the sense that your T3 available is too low?
Too low.
Right.
Yep. And then when people are hyperthyroid, they have too much thyroid. Those are the people who aren't sleeping well, they're irritable, they're having diarrhea 5 times a day, they're having a hard time gaining weight.
Right. Okay.
Okay.
All right.
So
that being said,
you're hypo.
I'm hypo.
You're hypo. And the way that I know that is your TSH, your thyroid stimulating hormone, which is again, kind of like with the FSH and LH. This is brain talking to thyroid.
Okay.
And your brain's yelling.
Can you give me like an example of what that yell would sound like?
It's like, what are you doing? Work harder.
I'm sorry, I didn't want my vegetables. I'll eat them.
You call this enough thyroid hormone? You're killing your father.
You're killing your father. I'm sorry, Mommy doesn't hit you anymore.
So that's what's happening, and this has been going on for a while. And
so my TSH level is 4.83.
Yes.
So greater the normal range Optimal is 0.27 to 4.2.
So I like to see it between 1 and 2.
Oh, yeah. Oh, wow. Okay.
Some docs will let it go up to 5.
Which we're basically kissing 5. We're
yeah.
We're like petting 5 and walking away.
Right.
And waiting for 5 to summon us back.
You're like...
I'm here. And we can talk.
Right.
If you've got the goods.
Yeah. So...
4.83. And you explained this to me already, but we're reiterating for anyone who may be interested. What does that mean? The TSH being that high. What specifically is that saying?
It's telling me that your brain is not happy with the amount of hormone that is thyroid hormone that you have.
So it's sending a signal for way more.
Yeah.
And it's just flooding me to make more.
Yep.
However, my free T4 is almost in the low range.
Right.
It's well, no, I guess not. I guess it's in the low middle. Mm-hmm. But it's getting the signal to make a shit ton.
Right.
Right. And that's a problem. Why?
It's a problem because it can contribute to lower energy. It can contribute to depression. It can contribute to just overall metabolic processes. So although you have lost 16 pounds, which is good, some people report that they are overweight and they have a harder time losing weight.
Sure. Just by their TSH being that high?
Yeah, potentially.
Okay,
potentially. And also, within your context, your cholesterol levels might be influenced by this process.
I see. Okay.
Yeah.
All right, cool. So what are we going to do about that?
So I think, considering that this is something that's been going on for a while with you, the last time we checked your TSH, it was actually higher.
Higher than this?
It was.
Shit.
And at that time, you were very reluctant to go on thyroid replacement hormones.
Because I'm scared to take things.
Yeah. So we did a trial with doing some glandular formulas, which you forgot to take. Not to out you, but I just
out
did.
Me, doctor. Let that be a lesson. Anything that your healthcare professional suggests doesn't work if you don't try it.
It's true.
How often does that happen when you're treating people that you make all these recommendations and you line them up with a plan and then they don't execute it and then they whine like I often whine about not doing it?
I don't have too many patients that do that because I call people out on it when they do it. And then they either start doing it or they find another doctor who lets them get away with it.
Ooh.
Yeah. I know.
All right, let's keep
But
moving.
it means that people who are in my practice get better, which is also awesome.
Right, of course.
So, Noah, it's time.
It's time.
It's time.
Time.
That we try a little thyroid replacement hormone with you.
So we're going to take, you said the thyroid replacement. Yes, we're going to get to what we're modifying for the testosterone replacement therapy. I'm just stringing you along because I want you to stay for this whole thing. We're going to take you said a free T4, a T4 supplement?
Yes.
And not a T4, T3.
I'm going to start you on just a T4.
Okay.
Particularly because of your skittishness around doing the therapy.
Right.
And I'm going to...
pretty low dose to start?
Yes.
Yeah.
I'm going to start you on a low dose. And then monitor your blood in about 2 months, and we'll pump it up if we need to pump it up, or lower it if we need to, which I doubt we will, because I'm going to start you on a lower dose. And
when taking this lower dose, what are some things I can look out for?
Well, signs of over-medication are going to be the same as signs of hyperthyroidism. So rapid heart rate, high anxiety, insomnia, frequent diarrhea, ravenous appetite, anything where it's revved up, metabolic, overstimulated.
Yep. Okay, cool.
Yep.
Now, given that I deal with anxiety anyway, big picture stuff, getting this optimized will only aid in that in general, right?
Correct.
Right.
Yep.
Okay, let's keep moving.
Yep. So I know you wanted to talk about your, and your vitamin D is great, so good job taking it.
Thanks.
I wanted to talk about, or you wanted to talk about, rather, your testosterone and the plan.
Yes, what's the plan with the testosterone? Obviously, I've always said to people that have watched my channel that taking the testosterone, like I worked up to 200, and a lot of people thought it was too high, and I always based that dosage with the provider that started me, and I know that you inherited me at that dosage off of side effect, profile, symptom relief, and my blood work. And up until now, I believed that I was doing the right thing, and I felt that wholeheartedly, but more as a sign of good faith to myself, not so much to people watching, but just to be transparent, which I've always tried to be with anyone who wants to watch this channel. I want to do whatever's best for me, mind and body. So if it's actually time to lower it, I want to be able to do that. Right. And I want to do that. And I want to do that. And I want to do it wholeheartedly because that's what's best. I don't have to be at a higher range. So,
right.
So I'm willing to go down, and clearly we have to do that. So we had talked about, you wanted me to cut 20%, or is that where your head was at originally?
Yeah, like 150, 160 is what it originally.
And I came back at you saying, I'm nervous about cutting so much all at once. Be it my personality, I'm sensitive, I'm insecure, I don't know what exactly it is, but I don't want to go down that far that fast. So we compromised for right now to do a 10% cut
10%,
and go to 180, and then we're going to do that for how long? Before we'll recheck everything, and then
let's do it for a month, and then we'll recheck it in a month.
This specifically the hormones.
Yep.
Okay, so we're going to switch from 200 milligrams a week to 180 every week for 1 month, and then we'll recheck blood work and see how things are going. So that'll be a 10% cut, and then of course I'll be willing to go however low I need to go to keep you willing to treat me.
Great. And then the thyroid, we're going to check in 2 months.
Okay, why not 1 month for thyroid?
Because they say 6 to 8 weeks just to get to your steady state and see how that therapy is working for you.
Okay. Yeah. And then I want to just plant the seed, because I heard you say it before to me when we were discussing prior to actually looking on this on camera. You'd thrown out HCG. You just tossed the idea out there. Do you want to play that close to the chest right now and bring that up at the next blood draw video? Do you want to plant that seed, at least what you were thinking there?
I'm just going to plant that seed of, at some point, transitioning you onto that therapy, so
rather than the exogenous testosterone cypionate.
Yeah, maybe we even keep you on the TRT, but at a much lower dose, and augment that with the HCG, because you're a young guy.
Tell me more. I'm just kidding.
You're a young guy. I don't think that we can make any. I don't feel comfortable calling any shots with your fertility.
Right.
Is what I'm getting at.
Right.
And with this TRT thing, are you going to be on it for the rest of your life?
I don't know.
Maybe not.
I don't know. I don't know.
But if we can, with the HCG, stimulate your gonads to make their own testosterone, that to me seems
more practical, long term,
more naturopathic.
Naturopathic, yeah.
Than just being like, here, body, here's testosterone.
Right.
You can chillax and not make any for yourself.
Okay.
Yeah.
I've heard people do that. Any speculation? If you can't think of an answer quick, then we'll move on. But do you know why that wasn't brought up to me to begin with? Because I said that to people. No, that was never brought up to me.
Right.
I didn't learn about that until months and months and months and months later. I heard that there was such a thing.
Yeah. I'm not sure that it's FDA approved.
No.
I need to double check that, but I know it's not the conventional way to do things.
Got it.
It's typically been a therapy that a lot of doctors have been skittish about dealing with, and they've said, only an endocrinologist should really be handling that.
Sure.
And in recent years, more and more of my colleagues have been having good results with that. So part of that is assessing if I would do that or if we would.
Okay, we'll cross that. We'll cross that bridge.
That.
We'll cross that bridge later. Risks of testosterone include, and you wrote, and I just want to read what you wrote. Okay.
Yeah.
So risks of high testosterone. Dr. Zelfand wrote cholesterol L. No, that's just cholesterol. I thought he wrote cholesterol.
Elevated cholesterol.
I saw the L looked like it was a capital L.
Oh, yeah.
And so I just read the. Never mind, it doesn't matter.
I'm a good doctor because I have messy handwriting.
Liver problems, maybe liver cancer, testicular atrophy. For those who don't know, that's the shrinking of my balls.
Which is another argument for the HCG.
True that, Cuddy. Mm-hmm. How's my PSA, by the way?
Oh, excuse me. I did do that, and it was normal.
Normal.
Yeah.
My PSA was normal. That is something you guys should always keep an eye on when you're reviewing your blood work. By the way, this is not in any way, shape, or form medical advice for you. For anyone watching, in any way, shape, or form, I'll put a disclaimer at the end of this video. We are openly discussing my stuff as just something you can learn from and use as a reference for your own personal curiosities. Please let me be perfectly clear. But PSA, I was always told that being high is a risk. That's a problem.
Yes.
That needs to stay in check.
Yeah.
Because if you are prone to growth in your prostate or something, then can't the...
Yeah, it's hotly debated whether TRT is a risk factor for prostate cancer.
Right.
So it really depends. studies and arguments going both ways.
Right.
So it's something that I always just keep a very close eye on, monitoring those PSAs for
Cool.
anyone who's on it.
Okay, and you wrote down rage and acne. I've never experienced the rage. I've experienced some of the acne, but it's largely gotten better over time. I'm assuming you have someone waiting out there for you, don't you?
I do. I have a 10 o'clock, yeah.
Okay. Is there any bullet points that we need to add to this right this second, or did we basically cover what we wanted to cover?
We basically covered everything. You know about your MTHFR mutation.
Right.
And I will also just say your creatine kinase is elevated.
Is there a risk to that?
No, it's a marker for muscle breakdown, and in your case, I don't think it's a heart attack. I think it's because you lift weights.
Got it.
So it doesn't tell us where, it just tells us muscles breaking down somewhere, and
Okay.
in your case, I'm pretty confident it's because you lift.
Did we check cortisol levels before I let you go? Was that something that we checked?
We did not. That's a salivary test.
I would like to do that.
We can definitely do that.
Okay, not today, obviously, but I had a few people say I should look into that.
Great.
And see where that is, and that made sense to me, and I wanted to bring that up to you.
We can definitely do that.
Okay.
All right.
Thank you.
You're welcome.
Thank you. Thank you so much, Dr. Zelfand.
You're welcome.
Everyone, leave really nice comments for Dr. Zelfand, because if you do, maybe I can get her to do this again. And we want her to do this again because this is an incredible gift that you'd be willing to do this. I mean it. Thank you.
You're welcome.
Otherwise, it'd be me just be like, so this number means it's yellow and this one's red. Because that's how I talk. Okay, awesome. We'll see you guys in another blood draw. Would you be willing to maybe do this again if they're not a bunch of schlemiels to you in the comments, and go over the month 2 results or after whatever follow-up
Yeah,
stuff?
we can definitely talk about it. Yeah,
Okay.
I'd be open to that.
Open to that. I like that. It could be a no.
How's that for non-committal?
Yeah, I love it. Okay, thank you guys. Thank you, and we'll see you guys in the next video. You guys heard we're finally lowering the dose, and so that's exciting. All right, take care.
All right. Bye.
Peace.